We do continue to cover the dangerous cold weather that is here, headed our direction really this evening too. It's only going to be getting worse. And Dr. Karen Gustafson from Midwest Orthopedic at Rush joins us with all the things that you need to know about hypothermia, frostbite, a lot of serious issues that we're talking about here. When you talk about wind chills, 40 below. What do you have to recommend today, Doctor?
So there are many different ailments that the cold can affect. So it can affect the skin, it can affect the lungs and the overall body. So you want to be careful with watching the skin. So it can start with frostnip. And frostnip is when you get this pain in your fingers, it become pale, numbness and tingling. Most people have experienced that before. And so you want to get inside when you start to feel those symptoms. It can then progress to frostbite. If it doesn't go away within 30 minutes, it can turn into frostbite. Frostbite is when you get waxy, pearly, kind of skin color changes. The skin gets very hard. You might develop blisters. The blisters can become clear and then start to become bloody, and they start to get black to the point where you end up losing fingers, nose, ears, and toes. So you have to be very careful about that. The cold can also affect your lungs quite a bit. So if you have a history of asthma, or if you're a smoker, or if you have an underlying lung condition, if you breathe in that cold air, it can induce coughing and wheezing and a lot of shortness of breath. So you need to be careful and make sure that you're breathing through a scarf if you can. And then there's also hypothermia. Hypothermia is where it affects the entire body. Your body kind of goes on overdrive trying to produce more heat. You might notice that you're getting a little confused, very fatigued. Your heart rate may go up. And then once your body can't overcome that, it starts to slow down and you get really rigid muscles and your body just gets very, very cold.
All right, we're talking about, Chicago Public Schools, they're still in session tomorrow, and obviously parents are supposed to use their own discretion according to the CPS CEO, but that raises some concerns about if you have people going and walking in the cold, or a lot of folks do have to work outdoors too.
Sure.
So what do you say about the time of exposure? Obviously, stay inside if you can, but a lot of us can't because we're working and we're trying to get the story.
Right, so there's ways that you can try to avoid that. So you want to limit your exposure. If you have to go outside, then you want to limit your exposure by layering. There's different layers that you can put on your body. So you want to have a tight underlayer that's made out of polyester, and that won't absorb some of the water that you might perspire. And then you want to have a little bit looser fitting middle layer that's made out of fleece or wool or, again, polyester. You want to avoid cottons because cottons hold on to too much water, and then that makes you colder. And then an outer wind protective layer or waterproof outer shell. So 3 different layers is usually pretty appropriate.
All right, that sounds good. Thank you for that information. So important as we head into this. Thank you, Doctor. So ABC7Chicago.com is your resource with best practices to stay safe in the cold weather too. All you have to do is look for the cold weather survival section. We have it covered there. And we're going to be back in just a moment with more weather coverage too, right after this short break. Thank you.